Before we get into this, how long can you hold a wall sit? Seriously, find a wall, get into position and find out. I'll wait, because your answer to that question matters more than you probably think. Nobody thinks of the wall sit as a medical intervention, but a 2023 meta-analysis published in the British Journal of Sports Medicine just repositioned it as one of the most medically relevant exercises you can do. And look, I thought I knew this stuff. I didn't. The researchers looked at 270 randomized controlled trials, nearly 16,000 participants comparing every major exercise type for one outcome, resting blood pressure. They compared aerobic exercise, resistance training, high-intensity interval training, combined training, and isometric exercise, the kind where your muscles contract without moving. Think planks, wall sits. Here's what they found. Every exercise type reduced blood pressure, but isometric exercise reduced it the most, by around 8 millimeters of mercury systolic. To put that in perspective, aerobic exercise, your running, your cycling, came in at around 4.5 millimeters of mercury. Isometric exercise was nearly double that. And when they drilled down to specific exercises, one came out on top. The wall sit. Not the treadmill, not the barbell, the wall sit. Ranked number 1 out of every exercise tested for lowering systolic blood pressure. An 8 millimeters of mercury drop is clinically meaningful. Reductions of that size are associated with roughly a 13 to 22% drop in major cardiovascular events. Some studies put it in the same ballpark as first-line blood pressure medication in certain populations. That's not a reason to stop your meds. It's a reason to take this seriously. Here's what's actually happening inside your body during that hold. When you hold a wall sit, the contracting muscles temporarily compress the blood vessels around them. When you stand back up, there's a reactive surge of blood flow, and your vessels respond by releasing molecules that cause them to widen. Over time, with repeated sessions, your vascular system becomes more responsive. Total peripheral resistance drops and resting blood pressure follows. It's the same reason grip strength predicts cardiovascular risk. Isometric strength is a window into vascular health. The research-backed protocol is straightforward. 4 sets, 2 minutes each, rest 1 to 4 minutes between sets, 3 times a week. That's around 24 minutes of total work per week. No equipment, no gym. One important note, during the hold itself, blood pressure spikes acutely before dropping afterward. That's actually part of the process. But if your blood pressure is already high and unmanaged, check with your GP before starting. This is backed by clinical evidence, but it's not a replacement for medical advice. There's now a full-scale NHS trial underway testing this exact protocol in over 500 hypertensive patients because the evidence is compelling enough that they want to put it into clinical practice. So, how long did you hold? Drop your time in the comments, and if this was useful, you know what to do.